Hello, it's Dr. Rhonda Johnson, and today is Monday, January 17th, 2022. And today I'm going to be talking about pediatric diabetes and COVID. Well, folks, last week the CDC released a report in their prestigious scientific journal that looked at the cases of newly diagnosed diabetes in pediatric patients who were less than 18 years of age who had COVID infection. Now, the time period for this study was March 1st, 2020 to June 28th, 2021. And the reason why I highlight that was because this research was done before the Delta variant wave and before the current Omicron surge. But back to the study. The CDC researchers found a significantly elevated risk for a new diagnosis of diabetes 30 days or more following COVID infection in pediatric patients under the age of 18. Now, it is not clear how COVID can increase the risk of developing diabetes in pediatric patients. The researchers offered a number of possibilities, but that information is well beyond the scope of this particular message. And I also want to note that many of the children have been hospitalized for respiratory complications of COVID. So why do I think it's important for parents to know this? Number one reason, it's just one more reason why parents should get their kids under the age of 18 vaccinated for COVID. I want to remind parents that kids 5 years and up are eligible for the Pfizer vaccine. Also, number two reason is that parents, if you have a child who's under 18 who had COVID, they need to be monitored for long-term consequences, including signs of new diabetes. And my third reason for sharing this study is that parents, you need to be aware of the symptoms of pediatric diabetes. Healthcare providers know these symptoms and they can easily screen for diabetes, but parents, these symptoms can include frequent urination, going to pee, increased thirst, increased hunger, weight loss, tiredness or fatigue, stomach pain, and nausea and vomiting. And really, kids can have any combination of those symptoms, or they may have other symptoms, but those are the common ones. So that's my message today. Just keep in mind, parents, this is one more reason to get your kids vaccinated for COVID. As always, my views are my own, and I hope you will stay safe. Take care.